In this series on the ACL and the injuries that occur with it, we'll walk you through what to look out for in a history and what findings that we'd look for during the examination process. And then the next step would be to look at the medical imaging choices that will be at our disposal in order to rule in or rule out an ACL injury. And last but not least, we'll review the different conservative or non-surgical and also surgical treatment options that will be available for all ACL injuries. The majority of athletes who injure their ACL will describe a relatively characteristic history. Generally, there's no significant trauma and it's a non-contact injury, meaning that it's not caused by a collision with another player or object. The athlete or witness to the injury typically describes a twisting injury. So for example, landing from a jump or changing direction or during a decelerating phase, otherwise slowing down. The injured player often reports experiencing a popping or a snapping sensation followed by a rapid general swelling of the knee, known as a haemarthrosis, which is bleeding within the knee joint. And they'll also feel a strong sense of instability within the knee, the feeling that something's going out of place. And as a result, the majority of people who suffer this injury are reluctant or unable to weight bear following the injury. The severity of pain that a person or player experiences is very variable. An example of an ACL injury is when Michael Owen injured his right ACL whilst playing for England versus Sweden in the World Cup. But at this point, it's important to remember that no person was ever born from a textbook.
Yes, we are all different.
Therefore, it's very possible that an athlete or person may experience all, some, or none of the symptoms that we've mentioned so far. And getting the correct diagnosis early is extremely important because if not, the injured person may go on to develop recurring instability, perhaps early degenerative changes in the meniscus and also early development of osteoarthritis. The person with undiagnosed ACL injury will likely describe a severe loss of confidence in their knee with episodes of recurring instability and swelling.